What if the body could heal itself? So there's a whole lot of discussion about stem cells, and we're going to talk real quick here about what the different types of stem cells are, how they could be of benefit, and how maybe they couldn't be. Hi, my name is Dr. David Boyd. I am the private physician to most of the celebrity entrepreneurs that you follow on social media. If they're on social media and they're an entrepreneur, they're likely my patient. Follow me for tips, tricks, and advice that I give to billionaires. Welcome to my channel. So I want you to consider that when we say stem cells, it's a lot like saying cars. Just like you have a bunch of different types of cars, you have a bunch of different types of stem cells. So just like cars, you have sports cars, SUVs, trucks, etc. Stem cells are kind of the same way. So let's start with the simplest version of a stem cell that you can think of, where they gets grouped in a lot with it, and those are exosomes. Now these technically aren't stem cells. What they are is really growth factors. I equate this to if you took an egg, and that egg was the stem cell, and you cracked that egg open, and you only used the egg white, like that stuff that's in there that otherwise is just suspended with everything else. That's really what exosomes are. And folks will often use exosomes just to try to trigger growth factors to try to get things to happen in the body. Almost like if you can turn them on to stop with aging or help with making some improvement. Exosomes are used very, very often, particularly in the aesthetic space. So we'll talk about FDA clearances and things like that in just a little bit, but particularly for exosomes, FDA allows folks to use exosomes, particularly when it comes to anti-aging treatments in the face. So it's things to help get rid of fine lines and wrinkles and things like that. Let's move on to the next category. And these are stem cells that basically come from yourself. So we have a component of our blood known as platelets. And platelets are these cool little things within our blood that you're actually familiar with, even though you don't know it. When you accidentally cut your finger and all of a sudden you'll notice that it starts to clot off after a while. It's platelets that get triggered and go to that cut that all kind of get together and block off the bleeding that's occurring. We can take those same platelets just from drawing a vial of someone's blood, put it in a centrifuge, and spin it down fast enough that you actually see the blood separate. So when you see it separate, that yellow portion on top, that's the platelet plasma portion. And you can actually just draw that off with a syringe and then re-inject that into someone. This is done a bunch of different ways. It's known as PRP, platelet-rich plasma, that you actually can go and inject. If you do it in the scalp, it can help to generate hair. If you do it aesthetically, for instance, in the under eye area, it can actually help to stimulate collagen. So you can use PRP for a bunch of different things, but that comes from within our body. There's also a mesenchymal type of stem cell that is done very similar with the platelets, only it's from fat, where basically someone will go and take some fat tissue and extrapolate the fat out, spin it down, and inject that into key areas as well. I'm not a big fan of the whole fat transfer. And the reason why is because it's not as potent, and you'll see here in a minute, there's just other options that are better. Kind of the granddaddy when it comes for what is the best type of stem cell, if you had to choose, is embryonal. Now, folks very often think that this somehow hurts a baby, damages a fetus. That's completely not true. You have to understand. So understand the birthing process. When a baby is born, that baby was within the placenta inside the mom. After the baby's born, the placenta then comes afterward. Is also known as the afterbirth, if you will. We can show a picture of it here, but that might be kind of gross. But essentially, from the placenta, within the placenta itself, there's a main vein, the placental vein. And so what happens is it usually gets donated to harvest. You take a big syringe, you stick it in that placental vein after the baby's born and after it's come out of mom. So it's usually just sitting in a stainless steel tray. And you can draw off what is a really rich amount of stem cells from that placental vein. Then that gets sent to a processing center where it's scanned for any kind of diseases or viruses or anything like that. And then the stem cells get extrapolated out of that. These are the richest, most potent stem cells on the planet. Why? Because they're literally brand new. Those then get essentially flash frozen and are kept in a cryo chamber so that way that they're in suspended animation. Essentially, they can't change at all. We're going to talk about those in particular for a moment because those are really the gold standard when it comes to stem cells. Now, here's the thing. Right now, there's not FDA approval for use of those in the United States, with the exception of very certain occasions, particularly when it comes to some aesthetic things and some joint things. So particularly if someone has failed other therapies for, let's say, their knee, their ankle, their shoulder, they've, had chronic pain within those areas. Maybe there's a lot of arthritis. You see this a lot of time in elderly folks or in former professional athletes or current athletes, where they've gone and they've done everything they can to try, like physical therapy or steroid injections or hyaluronic acid injections, which tries to increase more synovial fluid to be made and for more cartilage to occur. And once all of those have failed, then usually insurance, or sometimes not, will go and allow for someone to then go have a stem cell injection in one of those main joints, particularly stem cells that are embryonic. Those are the rare occasions that it's used. Otherwise, it's not legal. It's literally, you can't use it in the United States. But here's what happens. Because folks see that this is the potential holy grail here of stem cells, that they can potentially do so much, there is a massive business outside of the country. Folks will travel outside of the country to go and to get these amazing embryonic stem cells in other places. The problem is, as far as for the controls that are there, we just don't know what they are. The US has the highest standards when it comes to making sure that all of the diseases have been checked for, or that there's no viruses, or that these stem cells are as clean as they can possibly be. You really can't speak to that in other countries. So particularly, you have places within Mexico, South America, Eastern Europe, for example, where folks can fly to these places and get the best stem cells, but you don't exactly know what's what. So where are things going with this? I want you to consider that, yes, there is amazing potential that can occur with stem cells. Currently, like with the current use of even things like PRP, which comes from yourself, or there will be expanded use of embryonic stem cells that will likely happen. But what you need to be careful of is if you're going to spend your hard-earned money on stem cells, you need to make sure that you can validate the actual source. The source really, really matters. And the higher the quality that there is, the higher the quality of the result that someone can actually get. Here's my prediction. My prediction is that for improved longevity and for overall improved life, what we're going to start seeing in the next few years is people adopting IV versions of these embryonic stem cells in an attempt to try to slow down aging. As we slow down aging, and in this age of AI, what we're going to see is the interpretation of medical data faster and on a more regular basis so that we can start incorporating each individual's personal information when it comes to what do their labs look like, their habits, their family history, and start trying to reverse the negatives on that using embryonic stem cells so that folks can live better, longer, and have absolutely amazing lives. Where do you think stem cells can fit into your life? And is this something that you would even try? Would love to hear your comments below. Make sure that you give a like and a follow. And remember, health is wealth. Invest in yourself. I'm Dr. Boyd.